Good morning to you, our viewers on Island, our residents on Island and St. Lucians in the diaspora. Thank you so much for tuning in on air and online. This is St. Lucia's COVID-19 response report, the week in review for the week 4th May to 8th May. We're just looking at everything that transpired, all of the developments, and we have quite a few to bring to you this morning. My name is Jessie Leonce, and I'm joined in studio by my colleagues, Mr. Carlton Cyril, Tony Nicholas, and in the words of admirer Primus Hutchinson, we have the effervescent and erudite Lisa Joseph in studio. Good morning, ladies and gentlemen.
Good day.
So
I was hoping you would have said.
Should I represent now and say po po po?
I was hoping you would have said what Primus said there in Creole. How do you say that in Creole?
Boy, Tony say la mwen de kadi temwe kachile pou kase sa Jessie dia. Bobo di jodi a se samedi e kou kaiwe hodia nou ni Madame Lisa epi nou ni Jessie epi Tony kon la koutim wou ki pa wè sa ki fèt pou si men nou ka viye menen tout bagay réfléchi se velo ek ba ou development nou ka di bonjour ek merci espresement pour ces gens dans l'autre pays nous savons toujours qu'à suivre ces gens sur internet là nous ka di bonjour ba ou ka koute nou par radio nous ka di bonjour toujours un plaisir jodi a wete en écoute nous dans chaque information développement pour viye réfléchir lido ek do merci tellement et toujours un plaisir pour nous à sous ensemble de bon matin.
Okay, we're going to start with the confirmed case for this week. We confirmed the 18th case of COVID-19 this week. The individual was a 51-year-old male, and he sought care at one of our respiratory clinics with a dry cough, but none of the accompanying symptoms of COVID-19. He has had no known travel history, and according to the Ministry of Health and Wellness, they are in the process of investigating the source of it. The individual is currently in care within the respiratory hospital and is responding well to that treatment. And of course, this week we saw the contact tracing efforts of the Ministry of Health and Wellness along with other first responders, the Royal St. Lucia Police Force, heading down to the area of Miku North where the individual is from. And certainly a lot of persons, there was a lot of concern, a lot of worry, a lot of panic, to the point where we had the MP for the area, Dr. Gail Rigobert, speaking out and just assuring her constituents that all was well, and it was just the usual contact tracing efforts on the part of the officials, the authorities. Also, we had 2 COVID-19 cases that have since recovered this week, bringing our total recovery, we're not back to the 100% rate, but bringing our total recovery to 17 out of our 18. So we have the latest case being treated right now at the Respiratory Hospital, formerly known as the Victoria Hospital, and we have a total of 17 since recovered. Tony, quite a stir things created down in Miku North this week. Persons wanted to know what was going on, but it is just that, I mean, this individual, was another case of not having any known contacts who had a travel history, and it really was on the part of health and wellness officials a task in terms of tracking everybody,
Yes. Yes.
Tracking everybody.
And not only that, not just the tracking, but trying to diffuse any panic that this may have caused within the population, not just in Miku, but anywhere on that east coast of St. Lucia, because we've heard the reports of persons, coming in illegally because of the closure of St. Lucia borders. So the government and the ministry have since allayed the fears of citizens, that they're doing all within their power, with the assistance of the Royal St. Lucia Police Force, of course, in terms of containing that situation as we speak.
And I think it also, that incident and the circulation of the videos also speaks to that always very sort of troubling facts when you're dealing with medical history, to having to test people, confidentiality. That idea that people now can pick up their cell phones and just go out there and film and then post it for the world to see, because discrimination forms a big part of COVID-19, like any other infectious disease. Now, when you do that and you put people's homes, a community at the forefront, we're so small in St. Lucia. Everything becomes a topic in St. Lucia. And as we saw, and I like to draw the parallels between COVID-19 and HIV/AIDS. That discrimination, it may force people to go underground, people in that home, they're passing on the streets. And so, sorry, Cox, I'm taking your language. But, you know, that's the house. People were in there. Yes, I tell you. And they have a sister over there and an aunt who's somewhere else. And how people now begin to feel that sort of unwanted pressure. So you want to stay in. Now, it also, that impact, while these people are living through that, that impact is now to force others underground. If I feel I have a cough, if I feel a fever is coming on, then I don't want to have to call for help because the ambulance must come and everybody's going to see. Then they say we have COVID. My people going, I'm infecting people, and let's
the whole family
do
comes
that.
under scrutiny.
Yes, let's not do that.
And it's so true, Lisek. Moi, ko kale pi kon nou ka diskite dat si men sa nou vwe de moun la kayo kay sav pani dje lontan nou te di nou pani pieson ki ni COVID pour l'air, mais ça pa vle di yo pati ka teste. Ek moi-même de bien pele mwen tan yo de gadi 100% nou pa ni pieson ki ni. But moi kwe nou te ni pou ka mette attention nou asou, mesye nou poko henje wizon. Mesye chonje nou ka kombate toujou. Ek mi aprezen nou preske an même ligne nan, kon Jesse bien di, aprezen nou te ni 18, yo vwe de moun ay kayo, nou ete yon moun ka pren traitement. Ek mi, bon question se, l'envie ek tout moun de, koks te ni virus la, sel bagay, pa pase bon, mwen koks, ou pa have, se mwen ten maman ite ni yutoui, ek mi ti fia ite kay la kay fom da, yo mene yi desen. Ek mi lot bagay lan, si, mwen epi Jesse, ek Jesse, mwen Jessica di, si mwen epi Jesse, epi yo mene mwen desen, tout moun sa mwen te epi Jesse, yo mene Jesse quarantine, me yo ni mwen isolation, qui voulait dire moi ni 20 minutes moi testé positif Jesse négatif juste let Jesse vie because yo ni pour change Jesse là pour faire assis oui pas ni avant y aller tout le monde ga Jesse ni quoi moi ga ça nous voulait dire que moun comprendre c'est là vini pour situation ou pas supposé qu'avait un moun après traitement c'est pour ça yo ka mettre yo 14 jours dans place là c'est pour ça yo ka vrai test là c'est pour ça yo ka ban nous rapport pour dire OK yo vrai 45 tests il vient tout est positif et ben pièce pas positive ça négatif yo ka fait ça pour moun savent les nous voir c'est moun ça dehors laisser moun ça vie c'est moun ça yo pas ka poser pièce problème by personne yo pas ça by personne maladie yo pas ça si moi j'ai quoi moun ni pour changer ça moi bien content nous adresser ça bon matin quoi nous ka dit cette ici sou ka coûter pas dit nous ka visiter ça qui fait ainsi maintenant nous ka bien dit laisser moun ça ou peut connaître qui trouve quoi yo testé positif vie c'est moun nan pa ni rien c'est moun nan la même comme moi pour changer yo traiter yo changer c'est pour ça yo voye l'hôpital so il pas un bon baganik mettez pied en soulier c'est moun ça pour dire si c'est ou qui vient au point traitement ou comprendre que vie avec tout moun gavo à sous côté quand a de laisser c'est nous gens nous frères nous so on changer ça pas du temps nous ga discuter avec nous ga dire nous simplement ni yon cas mais bagay la qui bien important yo ka fait test toujours yo ka vwe ces tests là avec tout temps yo pas un test sou avec résultat test sou yo pas ça de ou ni pour aller c'est là yo savent tout bagay bon.
Just one other quick note on that, Cox. We talk a lot about, well, why don't they tell us where these individuals are from in terms of the communities that they're from so people can be careful and so forth. The thing is, in Jamaica, we know about we heard about St. Catherine being on a lockdown, and so we know St. Andrew and so forth. We know that in other countries, they can do that. But I don't think in St. Lucia we've developed nor demonstrated this maturity as a nation for us to be able to be told such information. Because look what happened down in Miku. That is why the authorities are very hesitant to give us all of the information pertaining to location.
But even in Jamaica, where some of the communities were named, we heard of incidents where even some of the healthcare workers who are from those communities being discriminated against. You know, so we have to be very mindful of those things at all times.
And I just think shortly before we switch or we move on, one of the most important things is the reports, Tony. I think we heard it in the media and the plea out there to ask persons to report such incidents where persons come in back door. You know, if you are aware, I mean, the dangers that's in it. Just imagine you're following protocol, you're doing everything you're supposed to, and then for some reason in the community, you know, Tony comes in through back door, he's been to the community, he tells you he's not even following protocol, and then innocent you with an underlying a health issue. You know, you're asking yourself.
So you're saying that's where we should be rerouting
Even
our
that
discriminatory
Yes.
energies.
Yeah.
We should be blowing the lid of
Okay.
those beyond those people. That's what we should be doing.
Absolutely. Well, testing continues, and we've seen that there's been increased testing on island. The latest batch of
Beautiful.
tests, 45 yesterday, came back all negative, and the 33 earlier this week came back negative as well, bringing the total number of tests in St. Lucia to 620 tests so far. The director at the Ezra Long Laboratory did indicate to us that the testing that is being conducted is largely zoned in on persons who show symptoms of the COVID-19, as in the case of the dry cough. Right. So let's just hear from him on our testing capacity so far in St. Lucia.
With regards to testing, what we've done over the last 2 months is try to develop the on-island capacity to do that testing from a point of zero to having been able to do tests with on-island. It's been a troubled road. I say trouble because we've not been able to meet the consistent levels that I think most clinicians, most nursing, and the various clinics are hoping to have. And when I say consistent, I mean a turnaround time of consistent between 24 hours or even less, which is what we're ultimately trying to be able to do, where we can probably get a result for somebody sampled for over a period of 3 to 4 hours. But that road has been troubled due to supply chain issues that we've had. When I say supply chain, I mean there are certain products that we need to carry out the testing process, and they have been coming in not in the amounts that we've asked for, but luckily this week we were able to, on the weekend, we were able to receive a donation from the Cayman Island government of 5,000 test kits, which has further increased our testing kit supply to a number of about 13,000.
That was Dr. Wayne Lucien, director of the Ezra Long Laboratory, speaking on our testing capacity. He also mentioned during that interview earlier this week from the NTN studios that the lab is also due to receive a more robust analyzer to do the testing and an automated extraction device this week. So we'd have to get a follow-up on that from the lab that would reduce the time frame for turning out results. St. Lucia is constantly receiving supplies from PAHO and the International Atomic Agency. I believe the Atomic Agency will be receiving the extraction device from them. So we are getting all of the facilities that we need to be able to increase our testing on island. Another thing that Dr. Felicia mentioned was the need for increased community testing. We're testing persons who are coming into the respiratory clinics and saying, you know, I have a cough, I have, symptoms, but we need to go out into the community and, do more testing to get a better picture of what this no travel history connection, persons who have no connection whatsoever, who may have or have contracted the disease. Just moving on, we had this week 219 St. Lucian cruise line workers repatriated to St. Lucia. That was yesterday. We had that's the second batch of cruise line workers returning home since the onset of COVID-19. 207 from Carnival Glory and 12 from the Caribbean Princess. They were allowed to dock in the harbor for their disembarkation. Now, just to let you know, if you saw the harbor, the boats in the harbor yesterday, it's not that we have tourism on and going and popping right now. It is for the return of our St. Lucian nationals who have been working on the high seas. The CMO Chief Medical Officer, Dr. Sharon Belmar George, she confirmed their immediate quarantining. So the authorities took every measure to ensure that there was very little interaction, and they went straight to quarantining that Friday afternoon. Alyssa, I believe you conducted an interview with the.
Well, yes, we do have an insert with the Chief Environmental Health Officer, Mr. Parker Ragnanan, and he detailed how the nationals were being processed. and what the expectation was. So let's hear from him on that.
We are doing two things. One is to looking at the medical records of the vessels and ensuring that there are no infectious diseases on board, and that's part of the review of the Maritime Declaration. After that is done, then clearance will be given for the vessel to disembark the nationals. Once the nationals disembark, they would then be screened by our medical personnel here. The screening would take two forms. One is a temperature check will be done, as well as monitoring for any visible signs of respiratory symptoms. If anybody poses such symptoms or elevated temperature, they would be managed separately. It is expected that once they have cleared the health assessment, that they would then board the transport that is provided specifically for them, and they would be taken straight from here to the designated facility for quarantine.
Okay. Now, we also had the External Affairs Minister, Honorable Sarah Flood-Bobra, and the COVID-19 Response Committee Chair, who is Minister Honorable Dominic Fede, and they explained what it has taken for the repatriation of these cruise line workers.
There were a total of 505 St. Lucians who were away, and this is really a big opportunity for us to be able to move some 219 coming on Friday. We are going to have another batch in 2 weeks' time, but we had to delay the arrival because of the fact that we don't have sufficient quarantine space to do 500 at a time.
We had indicated that we would have been prioritizing cruise ship workers naturally, because they were out there on the high seas. They were out there in vessels, and we had, as the minister indicated, 505 of those on a number of vessels. Yes. How many vessels, Minister?
About 10.
About
total.
10 vessels. So there had to be a lot of logistical arrangements to ensure that all those persons could find themselves on one vessel to be repatriated here, bearing in mind the border issues, the issues with CDC. Everything had to come together to make sure this was done in a practicable, expeditious, and above all, safe manner.
And I know that we were talking about the numbers, and really and truly, we have such vast numbers of St. Lucians in the diaspora. So when we're talking about having people return, we're not just talking about St. Lucians who are working on the cruise ships. That's just one. We have students who are still stranded in other countries wanting to return home. People who may have gone on vacation, stranded, and they also want to come home. So the numbers, I'm sure that there are St. Lucians in the thousands, if not just the hundreds, but touching the thousands, who really want to come home. But our capacity to deal with being able to quarantine every single person for that 14-day period. And there's even been an indication that perhaps people who are coming from the hotspots themselves would have to be staying longer, perhaps a 21-day quarantine period. So can you just imagine, where would we get that sort of space to put people? So,
ça me garde un bon point encore ou lever là là vini pour nous parler about ces moun qui retourner repatrié vini en Saint-Lucie nous ka ouais à peu près 219 ça nous ka dire c'est en chaque ces moun ça vie ça c'est ces moun qui dégato à sur bâtiment et en tout là nous parler by honorable Sarah Flood-Bobra était ka dit nous c'est moun ça l'année 500 nous mener c'est ça nous design mais yo tout parti à bord yon bâtiment yo de ka travailler à peu près 10 différents bâtiments mais arrangement c'était pour tous ces pays Kawaii blanc venir ensemble et puis c'est bateau à mener yo en pays mais bien important nous ka savent pour qui ça 219 parce que capacité à combien moun nous ça metté en ces places quarantine nan nou ni. Question bien simple, à peu près 300 quoi. Yo teni pour quitter là pour à peu près 40 moun et puis là autant ministre là dit bagay bon les 25 mois nous supposé kay ouais l'autre compagnie ka vini mais un point liste men qui bien important pour moun savent, c'est pas seulement ces gens qui travaillent sous bâtiment. Là ni moun qui allait sous vacances, là ni moun qui était ani plan pour vivre, là ni moun qui ay travail et pas chaque c'est moun ça vle vivre mais ça qui est bien important pour nous changer. Yo mène ces moun c'est que chaque c'est moun ça sorti place côté vers maintenant hasima ou j'ai bagay mauvais là tout bonnement. Quand yo ka prendre précaution. Premier pas yo ni pour prendre la fièvre c'est moun ça, deuxièmement yo ni pour essayer yo ni pièce bagay respiration yo et c'est pour ça yo ni pour mettre yo en dedans quarantine pour 14 jours. Raison pour ça c'est vers maintenant ou pas ka ouais là même à délai au niveau 2 3 4 semaines yo di en mois et ou pas ka monter pièce sin. So nous ka quoi moun ka comprendre pas dit nous visiter en osman si maintenant nous tan moun ka vie quand chaque moun ka dit pour qui ça yo ka mettre moun en quarantine il bien important pour nous savoir yo ka fait ça parce que nous pas vle en situation côté nous ka mener ces moun et puis à délai nous pas ka dit ben nous ha sav yo sorti côté qui peut-être ni vers maintenant et pour mener yo ici nous ka prendre précaution et pour faire assurer l'autre monde pas trouver quoi yo hen vers ça comme ça c'est kachil là nous ka quoi monde ka comprendre pour qui ça yo mettez ces monde ça en quarantine avant nous voyons kayo.
And I think we also have to emphasize that the efforts by the government of St. Lucia involved, I mean, it wasn't just a matter of the cruise lines just coming and dumping those persons on us.
Yeah.
You know, behind the scenes, you had the Ministry of Health, External Affairs, the St. Lucia Tourism Authority. You had the various consuls overseas, you know, negotiating and putting this thing together. And even now that they're here, you have the situation where while they're in quarantine, they have to be taken care of by the government in terms of these persons have to be fed and taken care of while they're here. So it's a tremendous effort on the part of the government of St. Lucia. We heard over the weeks, persons calling while we're on air, persons posting, you know, what is the government doing, bringing the nationals home. There was a cry out for that to happen. But it's not just something that could just happen with a snap of the finger.
No.
And you had those workers being in several parts, some of them in Europe, in the Mediterranean, some in Miami, all over the place. So it's a tremendous effort, but we're happy that we have this first batch of St. Lucians here in quarantine. And
yeah, but you know, Tony, that's a very good point, because I just want to share with you that while, Tony, as you said, people are saying, well, just bring them in. But there's such an involved process that is beyond the control of the government of St. Lucia or any of the other Caribbean islands. And I know people say, well, is it really the government that brought them in? Look, the cruise ships brought people to everywhere. But here's the thing. The CDC, that's in the U.S., and we know the Center for Disease Control in the CDC, there's a release that says it is allowing crew members to disembark from cruise ships in U.S. waters and return home if cruise lines submit a signed attestation stating that they have complied with requirements to safely disembark their crew members. And then it goes on to say that the CDC shared the information with all cruise lines in U.S. waters on April 23rd, 2020, to help crew members return home safely. Since then, several cruise lines have requested to disembark crew through this process, and the CDC stands ready to approve these requests with same-day turnaround. The list, there's a list that provided the information, and from that list, I found 89 St. Lucians on the Norwegian Epic, and that was submitted May 4th by the cruise line to the CDC. The Norwegian Escape also submitted on the 4th of May, 69 St. Lucians, and the Oceania Marina, 1 St. Lucian on board, and that was also submitted on the 4th of May to the CDC for these individuals to be able now to disembark. So there is a very involved process for you to be able to bring our St. Lucians home. So it's not a question of any government, whether it be in St. Lucia or the rest of the Caribbean, not wanting to. We do have a clip of one of the returnees, and after that we'll talk about what Tony brought up, the cost. We'll talk about the cost associated. So if we can hear from the returning St. Lucian speaking about his experience on the cruise line.
I believe I had a unique experience, unlike most of my colleagues, because of the departments I work with. I work with guest services. So up until yesterday, I was still working. I know that a lot of persons may have had cabin fever and all of that, but then particularly for me, it was a very good experience. I know that the company did everything that they could. Before we moved from our respective ships to the Carnival Glory, I mean, everybody was free to roam the ship as they would have wanted to. We were provided with meals and everything. The only downside is that when we moved from the other ships to Carnival Glory, because of the co-mingling, we had to move up in the level of security. So it moved up to drastic measures where you will quote unquote confined to a cabin, but you were still given the opportunity to go out, get vitamin D, socialize, of course with social distancing. I mean, I'm just thankful to be here.
And absolutely. And I think he's expressing for all those who came back home that they're thankful to be home. But his experience, that was his experience. And he spoke about not necessarily feeling that he was in captivity, or feeling perhaps stressed from the fear of being infected with COVID-19 or anything, but that's just his experience. But just to go further afield, with Grenada, as I said, all of the islands are receiving their nationals returning. So to the cost now. Grenada, there's an estimate that the approximately $9,500 to keep a person in quarantine for 14 days. That figure, $9,500 per person to keep them in quarantine for 14 days. And while they, of course, like in St. Lucia, they will be tested, and that those tests they send to thing. Now, over in Jamaica, they're looking at a $64 million tag there to pay for accommodation and food for 330 Jamaicans who are returned. And of course, they'll be quarantined. They return this week. And the taxpayers would also have to cough up another $758 million for the accommodation and food if there's a remaining 4,670 Jamaicans. And they have applied for them to return home and to where they'll be state quarantined. And it's $80 per day per person price tag in Jamaica there. So we're talking about hefty sums. I did hear on the news last night, one individual was indicating that over in St. Vincent, that the returnees were being asked, the returning nationals were being asked to pay for their quarantine. But I've just done a little research, and that doesn't, there's no truth to that from the official sources that I'm getting, that there's actually some agreement with the cruise companies who will be helping with that sort of repatriation cost. So it's like splitting the cost there. But we'll get more information on that. Now, I know initially in Jamaica, there was the statement that, or the government saying that they were considering if the returning nationals would have to pay for the quarantine. So that was on the table over in Jamaica. That has since been rescinded. But also people who are, perhaps not for the cruise thing, but other nationals wishing to come back home, they have to pay to return home. So the cost is just tremendous across the board. It's overbearing.
We are now due for our first break. When we come back, we take a look at we get an update on the first batch of cruise line workers that came that came in earlier, last month. Do stay tuned for that. We have it in the form of a report. And when we come back also, we speak on the lift of the liquor license suspension. Stay tuned for that and more, coming up in just a moment.
Cette lisi ka registre ve min corona ek I ka fe mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique la fe wolo parler en place publique kon bon lanme base ti boutique changer distance sociale 6 pieds Rodionalot, I ka travay tan, si ou senti ko pa cordial, quarantine ko, pas toi en contact et puis l'autre, en cas où te toi pe exposé. C'est un écuyer, free one ou ben n'importe clinique yo pou. Les pays a dimi à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous tous servi Jidla à toutes les.
Together let us win this war. Say to shall be a soldier. Together we can beat this corona.
Thank you so very much for staying tuned. If you're just joining us, this is St. Lucia's COVID-19 response report for the week that was 4th to the 8th of May 2020. Quite a few developments. We've gone over the confirmation of the 18th case so far, as well as our cruise line workers, our testing capacity here in St. Lucia. And this week we saw 219 cruise line workers coming. That is the second batch since the onset of COVID-19 globally. And we were just having a discussion as to the cost that it has on the government and people of St. Lucia, Lisa.
Yes, and we mentioned going through the costs for the other islands. Here in St. Lucia, we've already spent $7 million. On the quarantine process there, and that was only going to multiply.
No, we have 219 that just came in.
We have 219. So you can well imagine, because you're being treated there it's a quarantine facility. Your hotel is not turned over, so you now have your breakfast, lunch, and dinner catered to you. So the government is taking care of that, the cost of meals. While the hotels are now, the hoteliers are paying the staff who are at the hotel. But of course, we've had to take on extra personnel, especially in the medical field, to be able to take care of everybody who's there at the quarantine facilities. So it is an astronomical cost that we are facing.
One of the interviews we had with the minister, he did mention additional costs of things like utilities, electricity or water and what have you, to house those persons and make them feel as comfortable as possible.
Moi, c'est un bon bagay. Quand nous avons dit bonjour et merci, si vous avez chillé ça qu'a fait là, nous ici à Headquarters COVID-19, nous avons vu maintenant tous ces développements qui fait ainsi maintenant, et là nous avons discuté, là il venu pour ces jeunes qui repatriés et vie cette lycée, ou qu'ils savent 219 moun vie cette lycée, et nous avons parlé de ces moun ça autant là nous fait la tenir un rapport qui a monté yon ces moun qui dit yo te trouvé quoi yo pas te senti yo te en pièce manière en direction et bien pièce manière yo tchebe yo en dedans bagay te bon, il dit yo même te ka manger boire et puis yo te ka quitter au marché tout partout à bobatoire parce que à de là attend tellement moun ka ba tellement l'histoire tout moun ni en bagay mande ko yo pour information yo tande be yo ka répéter ça moun ka dit, mais ça qui bien important c'est pour tande il ka coûter le gouvernement à peu près $7 millions déjà. Et ça c'est pour premier pas ces moun yo après care. Ou kay savent chay ici place là côté yo ka chen ces moun ou ni pour bailler ces moun ça dité déjeuner dîner la ni utilité, la ni travailleur. Mais bon bagay là, c'est place business là, c'est mettre ces hôtels là qui payer travailleurs, mais gouvernement à présent ni pour payer pour manger, ni pour payer pour utilité. Et pas oublier là ni ces gens médical là, yo ni pour faire assurer ces moun ça, yo tester yo. Quoi nous ka ouais, nous ka dit pas dit un moun ka dit qui ça gouvernement a fait pour qui ça va amener ces moun là. Il bien important pour nous savoir ça ka venir en dedans et puis en prix. Et puis ça il ka venir puis là en dedans temps quoi présent côté nous ka bien ouais l'argent côté qui a sorti vous comprenez ça me dire quoi nous ka amener toutes ces informations il faut ça pas dit nous ka dit oui moun ni pour vivre oui moun mais mettez considérer toute bagaille c'est pour ça il pas panique fait panique battre mon bébé badio.
And speaking of that, well, yesterday's was the second batch that came in through to St. Lucia, repatriated to St. Lucia. And just to give an update on the first batch of St. Lucian cruise line workers that were repatriated, we have a news report coming from the Ministry of Health and Wellness, Fernell Neptune. Take a look.
A total of 8 St. Lucian nationals who were repatriated from a cruise ship will be leaving the Rodney Bay Public Health Facility, where they spent 14 days in quarantine. The individuals have shown no signs and symptoms of the virus. Minister for Health and Wellness, Senator the Honorable Mary Isaac, highlighted the importance of people being placed in quarantine.
It is very important that the government take it on its own to quarantine persons when they arrive in St. Lucia. Because I don't know if you remember, initially we were asking people to home quarantine, and that did not work well at all. So it is the government's responsibility now to ensure that persons are taken into quarantine in order to protect the rest of our population. That is the only way you can be sure that the people are adhering to the protocols and that they are going to remain in quarantine for the 14-day period.
2 of the individuals described what life in quarantine was like.
We enjoyed it. It was part of the protocol that we went through, but it was good. We enjoyed. I learned a lot because I came from Norwegian Spirit, and when we got to St. Lucia, you know, we really enjoyed every minute of it, and we learned quite a lot in terms of wearing the mask and washing your hands and those sorts of things. And I guess I'm going to take that back home with me.
It's healthy to be safe and to be here and make sure that you are not spreading the coronavirus, and just to make sure that we're protecting our loved ones before we go home and we don't spread it to the people that we love.
The 8 individuals who left the Rodney Bay Public Health Facility were each presented with a letter stating that he or she is in good health. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fernell Neptune.
So that was a news report there from Fernell Neptune, giving us an update on the first batch. I believe it was 8 individuals, cruise line workers returning home, now discharged from quarantine. And you know, the wheel keeps spinning until we can get all our St. Lucians home, as you would have heard from the Minister for External Affairs. We now move on to OECS news. We heard this week, we got the announcement from the Office of the Prime Minister that the St. Lucia Prime Minister, the Honorable Alan Chasney, has been appointed to lead in our tourism recovery in the region. He's been appointed to help to lead in the drafting of a plan to resuscitate the tourism sectors in the member states and COVID-19 overall. The head of health spoke to us this week, the head of health of OECS, Dr. Carleen Radix, and she said that St. Lucia has been exemplary among the member states in terms of our response to COVID-19, quick response, management of this pandemic, as well as speaking on the overall progress of the region's management. Take a listen.
St. Lucia has been exemplar in their response. I think certainly in the response at all levels and through all sectors, the health sector, the way in which the different sectors have come together for a coordinated response. And every response is important. So from the health sector response, the emergency sector and response in terms of transportation, certainly at the borders early on, and continuing in terms of continuing to consider the protocols, and then and generally ensuring that essential services and supplies continue as we try to curb this epidemic. But the results are showing there has been definite blunting of the curve and recovery of cases. So this is true for St. Lucia. It is also true for for all of our member states within the region, that actions taken are showing results. And the curve is certainly flat in the OECS region. It's been flattened, and that is compared to our neighbors in the north, where the numbers continue to rise. The curve continues to be on the rise. So we're doing good things here. And I think sometimes when things are not exploding, we think that nothing is being done, or the things are unnecessary. But it's because of all of the actions that we're collectively taking that this is happening. So I want to commend all the work, and a big part of that is communication. So I want to commend you, to your team. All of the work that's being done in St. Lucia is really resulting in the impact that we want to see.
So that was Dr. Colleen Radix, the head of health over at the OECS Commission. And we did hear that St. Lucia's Prime Minister, Honorable Alan Chastney, has been given that task of leading the recovery and response of the tourism industry in the OECS region. Wider now, CARICOM has also done the same. The heads of government for CARICOM, they met virtually on the 5th of May, specifically to continue the efforts to harmonize their responses to and policies on the multifaceted impact of COVID-19. And the heads of government established a subcommittee, which is being led by Honorable Alan Chastney, to have discussions with stakeholders in the tourism industry, including the hoteliers, airlines, cruise operators, and labor unions, to settle the appropriate protocols needed to ensure safety for workers and visitors upon reopening of the sector. And this would be informed by the regional public health policy. And the heads also stressed the determination to speak to the cruise and airline industries with one voice. The heads of government have agreed to meet in the coming weeks to discuss the financial and economic challenges related to the impact of the pandemic. Most critically as well, not just on the tourism front, but also in agriculture, the heads also endorsed the regional COVID-19 Agri-Food Security Action Plan to strengthen the region's food security in the face of the threat posed by the pandemic. And the plan was developed by the agriculture stakeholders, including the private sector. So, Tony, I know here we've been speaking a lot about food security, a lot about whether all of our eggs should be in this one tourism basket, that agriculture is the more secured form for food security,
yes,
ensuring that we are fed, as well as for us being able to ensure employment, even though we're faced with catastrophes such as this. So you had some discussion this week on the agriculture front.
Yes, and what was interesting about this is that we're seeing a lot of young persons taking the charge, taking the lead. We know of a youth in agriculture project that the Ministry of Agriculture have embarked upon. And I had a couple of young persons on the program this week, Windia Jonai of Jonai Farms and Sonika Emilia, who's an agriculture student. And they spoke of, starting that agricultural revolution. Let's just take a listen to what these two individuals had to say this week.
We need to create what I like to call a movement. I think we need to stop hearing that agriculture is important and agriculture is vital, and we need to put it into action. We need to have a transformation where we try to solve one of the components of food security, which is maybe availability of food, stability of food, access to local produce. And also we hear a lot about the world, starvation in the world, so we need to try to link it with one of the the sustainable development goals, number 2, which is zero hunger. Because as we know, research has shown that there are
over 800 million persons who are hungry and just cannot get access to food. So what I think should be done after COVID is that the powers that be, young persons, adults, they create just a movement in St. Lucia and around the world where agriculture is one of the most important sectors and a priority.
As a student in agriculture, I think that as young people, we need to work together to remove the stigma that has been attached to agriculture, because a lot of the times we find that this has caused a lot of other young people to look past agriculture. They don't think that they should be going into it because a lot of the times we hear that it's about getting your hands dirty, and that's not what it's about. So as young people, especially as she said, we should work together to create that movement where people understand the importance, and not only understanding it, but we make the necessary movements to ensure that people are well involved in agriculture.
There you had it, the youth in agriculture commenting on their own initiatives. What has been interesting, guys, is that we talk about the agriculture in one form, but we've also seen the move because of COVID that several of those persons, including one of my guests here, from Jonai Farms, that now the traditional way of you going to the market on a Saturday or during the week or picking up your fruits and your vegetables, what have you, that they're now offering to deliver. So you can make your orders online. You don't have to, I mean, a lot of persons now don't have the time to go down to the market. We cannot go to the market. And the whole question is, you know, beyond COVID, you know, will this form remain, you know, in terms of business opportunities where you could just call and twice a week person delivering, not just to the hotels or to the supermarkets, but to your homes as well.
Et moi, encore, pour nous parler de discussion, encore, moi, je voulais changer, nous avons visité tous ces développements qui fait pour ces maintenant. Nous avons sous sujet, là, il vient pour Premier ministre, nous, Honorable Alan Chasney, ou qui savent la information, nous avons Dr. Radix, qui tête, là, il vient pour ces pays OICS, là, qui est responsable pour santé. Et là, il a dit, dans rapport, il fait ici et puis non, aussi maintenant, il a dit, un chai a fait, là, il vient pour ces petits pays OICS, là. Là, il vient pour manière nous aménager vers une COVID, là. Il y a ces bagages là qui bien important, c'est d'être qui, parce que nous pouvons autant gel, mort qu'on y a fait, plus en autre là, qu'on l'autre pays, l'Amérique, il a dit, ça pas veut dire bagages pas qu'à fait. Il a dit c'est manière yo a doué ces situations là vini pour vers Covid là et là Premier ministre nous honorable Alan Chasney le 18 avril trouvé qu'on a prêté à un comité et ça yo ni pour faire examiner qui manière Covid déjà affecté nous, mais ça qui plus important c'est qui manière nous kay vivre ouvert ces pays là, qui ça qui est important, qui ça qui besoin changer et il y a ces questions j'ai cité poser là c'est lui même là yo adressé qui manière tout bail a passé qui manière bailler pour Saint-Lucie qui manière a jugé qui dit nous a fait très bien parmi bagaille les vini pour sécurité les vini pour agriculture et c'est ça ces pays ni pour discuter à présent moi changer dans ces bail là idée c'est les vini pour nous à présent vini qu'on passe c'est les autres ces pays ni to akayo yo la ka agi yo même ka prend ka problème yo bon nous à présent ni pour soin qu'on nous ni pour faire bagaille pour nous quand si nous venons ensemble nous kay plus fort et puis et nous une conversation like rapport Lucia ka dit nous côté CARICOM aussi yo a pointé Premier ministre là sous un comité pour examiner ça qui passé à là vini pour ces pays CARICOM dans Caraïbes là mais bien important il veut dire yo ni pour parler qui on voit là vini pour ces gens qui amener moun en tout touristes par plane par bateau yo ni pour parler ba ces moun ça on voit yo ni pour qui manière yo kay faire l'autre bagaille là nous attendant chaque parler dit c'est là vini pour agriculture qui manière nous kay faire avec manière Covid a changé toute bagaille avec mitoni parler puis en compagnie jeunes gens ni avec ces moun ça a dit distance sociale là nous ni à présent ou passant ni aller bon la place après avec dit rodi samedi ba moi fait commission moi gain légime moi tout ça moi brisé à présent ou ka ouais côté idée a vini di font quartier là pour monde délivrer bagay la caillou ou acheter ou aller sur computer ou aller online sur internet là ou gain bagay yo est-ce bagay ça kay continuer quoi à présent Covid a fait nous quartier dans différentes manières totalement.
But Tony, you got the sense then from your guests earlier on, young people, that our young people are up for the challenge, ready to really because we've been speaking about the whole transforming the local economy for quite some time. On the days on the school bench, we've been talking about diversification and all of that. I mean, I know now we're pushing for the 7 crops, and that's going to help with the, not necessarily diversification, but helping with our food bill, which of course is humongous. So, but coming from your guests, you're talking that they are ready, the young people are ready.
They definitely are. Because, listen, what you're seeing now, there are different tiers to agriculture. I mean, the stigma was that before agriculture is going down in the dirt and getting your hands dirty, your clothes soiled and so on. You have different tiers and different levels. Because, for example, the young lady here, she was saying they just started doing tomatoes. And they were satisfied with delivering tomatoes to the hotels. What they realized when COVID came around, you had other farmers with different crops, and they had no distribution. So what they did as a business plan, because you have the business aspect of it, is that they had the idea, they went to those farmers, they pooled all those crops together, and now they're the ones dealing with the delivery. You know, they're from Soufrière, so they deliver into Castries and all other parts of the islands. And I've spoken to several young persons involved in the Youth in Agriculture project. You know, you have the aquaponics, also mentioned the aquaponics. And even in terms of the space you need, in some of the projects, you do not need vast amount of land. You know, limited space in terms of, so even using the technology, the 7 crops you mentioned, with the assistance of the Taiwanese, you have the technology being employed now. So that's a different aspect of agriculture, where persons now do the soil testing. You know, so you have different tiers, and if you get more of those young people involved, and like my guest said, they're up for the challenge. They're all inclined to starting this agriculture revolution and getting more and more young persons involved.
I'm so happy about that, because at school I was just hopeless. You know, we had agriculture. Often I would not be a student to run away from a class, right? I'd run away from agriculture.
Well, you didn't have the green thumb, Lisa. I said some of us, it's either we have the green thumb or we don't.
Exactly, Tony. I would just destroy everything. Nothing.
But you
that just wouldn't do.
Ça moi vle dire tout ça nous ga dit là bon matin, ça qui bien bon pour nous ouais, c'est pas juste simplicité. Là nous ga parler Covid, nous ga parler qui manière moun ka manger, ko nous ka planter manger. À présent tout le monde l'habitude là c'est ou gen boîte macaroni avec mais un tournant dedans avec ou ni mian qui vini avec bay. Bon mi à présent c'est pays ça bien brisé manger. Si nous ka vu ça qui a fait l'autre pays, nous ka ouais c'est moun ça même ka prend que yo même ni problème. Là on y kon l'Amérique 6 millions de choses qui ne pas travailler. Et qu'on y pour soin ces moun ça. Ou ka mande ko ça c'est l'Amérique mais c'est moun ça ni problème là mais gardez opportunité à nous ni parmi qu'on en Caraïbes blanc. Dominique nan chay glo. C'est ici nan chay fig. Babad ni ki ça. Yo ni juice babad. Yo ni bagay. So ga quand te prêt nous prêt. Et nous avons parlé de, quand très longtemps nous avons nous venons ensemble comme Caraïbes. Est-ce qu'à présent, Covid a poussé nous pour faire ça? Est-ce qu'à présent, nous avons planté manger Ivan Dominique ça ban nous glo? Est-ce que nous avons descendu en Guyana? Pour qu'on mette là, mettez yam, mettez bagay, Guyana bay tout le monde bagay. Ou est-ce que ces bagay ça possible? À présent, nous pas un choix. Nous avons pour catcher les manières ça. Et moi, quand avant l'autre de temps, un homme sans femme, un nèg marron yé. Au début, monsieur sortement bas ça avant beaucoup habitation. Ben qui ça y est après ça nous avons chez moun qui a fait blague et puis après ça sur internet là moun n'a regardé qui ça on est là ben moi Patrick on veut Patrick après ça tout le monde veut pas mal vous comprenez pas ça pour bagarre après ça nous avons importance.
And that's the point I was trying to make, that I was not a student who would, you know, I'm not that agriculturalist. But we will not know unless we expose our children.
Yes.
And so I would think that we're at a point now where parents will allow children to explore all of their potential. Let's not just, you know, as a parent, you simply say, oh boy, I have a child. Okay, so you must be the doctor, you must be the lawyer. How many of those can we possibly have? We are seeing that really to be able to survive, it's really back to the basics. It's really back to the basics. If we were to have a problem now, God forbid, in the Middle East there with oil and so forth, wouldn't we have to bring out the what? The tesson? We have to get the tesson.
Fouiller à tout. Nous avons des questions. Oui, qui ça qui a fait? On nous dit saison hurricane n'a pas venu.
Yes.
Avec nous ni Covid. ek nou nan lot 3 mois COVID, yo poko hen Jewison, nou poko sav kon nou ka ale pi. Ki man yo kay treatment ho utan à présent, ek ga pri l'huile. Parce que c'est mon appareil, yo kay du bout de produit. Parce qu'il pas même faire science l'argent pour voir cette Lucie. Après ça, tout le monde a aller acheter bras. Donc, il changer fouiller à ces tessons. Comment qui ça fait tesson tout?
Hello, before that happens, you need to teach me how to do the lighting. I'm
hopeless.
Helpless, so you need to teach me that.
So, I mean, il y a vie pour montrer nous importance, là, nous ni pour balancer toute bagaille. Il bien vrai, nous ni pour ni docteur, nous ni pour ni nurse, nous ni pour ni c'est pas l'autre là, oui. Mais nous avons dit à présent, nous besoin femmes et nous besoin adopter. Ou changer d'entendre de garder tout le monde. Mais à présent, nous changeons à Bradley, quand il parle, il tout le monde un petit peine et qui a dit, nous commençons à supporter local. Et qu'on dit à la liste, quand tu es là, je nous avons pour mener ces produits sans tuer. Là, ça, nous mettons, nous investissons dans ces femmes. Parce que nous avons une situation telle qu'on exemple. Regardez les venus pour poule et puis au Catan. Si vous menez pour l'entrée, il a coûté moins pour mener un conteneur pour l'entrée, et puis pour vivre, payer ces femmes noirs ici à qui quand en poule. Bon, ça me regarde, est-ce que nous passons à mettre investissement ça en dit dans ces femmes ici pour y venir dans prix tout le monde s'acheter? Parce que dis-moi, si on a un parti pour qui ni 30 pour l'endroit, et qu'on y a qui ni 15, et qu'on y pour payer $40, bien, ouais, laisser $20 on y. Ou comprendre quoi nous ni pour balancer bail là mais moi quoi raison dans les quartier là c'est à nous veiller ça qu'a fait à présent nous briser on a l'autre bagaille c'est terre nous ni la mer glo à nous commencer planter.
And I must stick in here as well in terms of the agriculture and the produce, even in terms of the national meals program that's going on right now, the government of St. Lucia, everything that's been prepared by the hotels and the various kitchens are from our local farmers. And even earlier this week, I mean, speaking to the Prime Minister, an interview I did with him, where he said in Parliament, it came up the idea of providing those vulnerable persons with food stamps as an option instead of feeding them. And he was saying, okay, you give someone a food stamp to go to the supermarket. They're open to buying anything they want. They could purchase a couple of soft drinks. They could buy some craft macaroni as opposed to our local. But he's saying now that you're preparing a healthy meal for them, a well-balanced meal, and you're also supporting our local farmers through this initiative as well. So
and that support is really tangible, by paying them.
Yes.
Because the money that's important.
Recycling.
Absolutely. Definitely. We're watching the time. We're moving on from agriculture expeditiously for now. Moving on to the lift of the liquor license suspension. And this week, I mean, we turned our last sober corner, I should say, and we got word. You're still sober? We heard from the Honorable Minister for Commerce, Minister Bradley Felix, Minister for Commerce, Industry, Investment, Enterprise Development and Consumer Affairs, and he made the announcement that Cabinet had decided, all things considered, chief among them, whether the population had understood and had taken in the need to practice social distancing, as well as the extent of St. Lucia's maintenance of the gains in the management of COVID. And Cabinet made the decision to lift the liquor license suspension with conditions. So take a listen to his announcement.
As of this coming Friday, 8th May 2020, the government of St. Lucia will reinstate liquor licenses in St. Lucia for the sale of alcohol beverage. This measure will allow for the sale of alcohol by only licensed businesses from the list of approved businesses that are currently permitted to operate under statutory instrument SI 56 of 2020, namely supermarkets, mini-marts, small grocery shops, wholesalers, and gas stations. However, the resumption of the sale of alcoholic beverages from approved licensed business outlets will be governed by strict protocols. These protocols are as follows. There shall be no loitering, assembling, socializing at the business premises where alcohol is sold and purchased. There shall be no consumption of alcohol at the place of purchase. Alcohol sales can only take place between the hours of 7 a.m. to 6 p.m. The public is also reminded that a person who contravenes the Emergency Powers Disasters COVID-19 curfew order commits an offense and is liable to imprisonment with or without hard labor for a term not exceeding 6 months, or a fine not exceeding $1,000 or both, and forfeiture of goods or money in respect of which the offense has been committed. Therefore, as we lift the ban on the sale of alcohol, we urge St. Lucians to drink responsibly.
That was the Minister for Commerce, Industry, Investment, Enterprise Development and Consumer Affairs making the announcement of the lift of the liquor license in St. Lucia, Honorable Bradley Felix. And while we had the suspension of the liquor license, many individuals were at pains to understand, well, why do we have the imposition of the liquor license suspension? I wouldn't mention any names, but Tony indicated that conversation generally just rose onto how much of a problem do St. Lucians have with respect to alcohol? Why was there a suspension in the first place, which I think we have more than explained so far, but it really brought to bear the concerns over our level of consumption on island. And of course, Lisa, I know you had in this week the individual speaking about substance abuse and so on.
It was very, very, very revealing, because we had Joanna Joseph Henry, who is the deputy coordinator over the Substance Abuse Advisory Council. And she indicated that in 2006, there was a study done, a regional study done, and in St. Lucia's case, per capita, between 10 to 20 liters of pure alcohol being consumed per person in St. Lucia. Yes. 10 to 20. So we have 26 liters for males and about 9 liters there for females. And she indicated this speaks to a very serious problem in St. Lucia. I know that we are socialized around the drinking. And it's the truth, we can't get away. It's a cultural thing for us. Everything that we're doing, there must be some form of drink, alcoholic beverage in the midst there. While it's okay, it's not to say that we ought never to drink alcohol or anything of that sort, no. But I think this speaks to the consumption pattern that perhaps while some of us may be able to listen to our bodies and say, no, I've had enough, there are people who just do not know their limits and they just keep going and going and going and going. So we do have a problem in St. Lucia with alcohol consumption. And it's that, it's a conversation that we need to have. And we know that Mother's Day, that's happening, that's coming up tomorrow. There will be, and it's okay to celebrate because we had, in addition to Joanna, Fernanda Henry was on, we'll hear from her in a little bit. And it's okay because, we have all of those studies that tell us about the wine, the red wine is good for the heart and so forth. And it's also good as part of your socialization. All of your endorphins are released at that time. You're happy, but you must know your limits. So, and one of the concerns expressed is that binge drinking. So now that you've had the lift, people will decide, well, boy, let me now drink for all the time I didn't drink. And really,
moi bien content Lisa ek moi sa nou te ka vinn dans ça moi même te ka espérer pour quitte date et ben qui le nou ka venir ek nou te ka étendre annoncement là vini pour ka visiter tout ça qui fait en semaine nan pour ka étendre tout monde ka dou qui joue moi ka hen moun les chimé ka di kok so premier ministre pas ka la Jérôme nan qui joue ka la Jérôme nan et ou ka demander ko est-ce que nous ka combattre Covid toujours est-ce moun pas vle ça qui joue nous ka hen vaccine qui joue nous ka hen oui mais ça ou continuellement ka tant moun ka dou ka so premier ministre pas moun brise bois ou ni pour boire wom nan ka so qui ça yo ka faire et
maybe they want to drink because releasing the stress is that what it is to take take the edge off?
Oui, nous pour discuter. Moi bien content de nous discuter, mais est-ce que qui ça qui situation? Est-ce que nous a bien dit là vini pour homme that qui nous un problème homme? Est-ce que nous a dit ouais homme mais ou supposé connaître limite tout? Est-ce que nous a dit homme n'a pas dit temps nous point qu'on bagaille pour di pas dit temps nous ka prend nous ni problème nous ici en solution et bien qu'il y a un petit soulagement. OK, mais combien homme qui c'est assez homme est-ce moun connaît dat qui mi c'est deux ou ça boire deux et bien sous compte Jesse c'est 10 000 bouteilles ou ça boire ça ou comprendre
Jessica for a bouteille
non pas 10 000 petite bouteille mais question c'est nous attend tellement parler de homme et tout bagaille c'est homme et ça nous bien savent. Moi-même pas qu'à y dire mais nous ça plus on vend pas du temps parce que là fait mais tout le monde cache garçon côté qui ni on caillou ou ni et nous ka demander quoi nous question qui ça qui a né comme ça et moi quoi ou maintenant bon point et ou garder un bon bagaille et moi quoi on dit parler dit là parler puis manger Henry Joanne qui dit qu'on là examiner 26 litres pour yon homme et quand femme 9 litres dans yon étude yo fait ou ka dit moi 10 pour 20 litres warm. Ça c'est un chai warm. Et encore en cette nous pas parler sur ça parce que nous c'était jeudi là on a Bradley Felix Vinicius et puis dit le gouvernement a considéré que il permettre ces places là qui a prouvé pour vendre warm. Et moi quoi était bien clair pour dire ces places là supermarket, minimart, ces petites boutiques là qui ni permission pour ouvert et ces places là qui a fait warm gas station. Et nous demander qu'on nous question est-ce que nous pas kay wè moun ka di garçon ou 3 semaines 4 semaines ça maté bois naï boiton naï bois wom est-ce nous savent qu'il est pour doubout et c'est là problème nanté parce que distance sociale là c'est ça qui ou savent de bon nanti wom dedans joua masadou rien li ça tout ça moi vle dou là moi kay dou les moi ni
all your inhibitions are gone
et moi vle venir pour ou dou ça tout because à présent qu'on dou même di ça là Dieu tout ça tout perwes ka disparaître. À présent ça parler so question vraiment messieurs et qui c'est bagaille nous ni pour parler à nous ni pour discuter là vini pour homme nous d'accord cox ou pas faire ça homme il like qu'on nous bien dit demain c'est fête maman ou ni pour ni homme mais comment est-ce moun savent qui manière pour comporter quoi est-ce savent qui l'est pour dire OK moi na c'est ben quand oui veut like dit Tony ni tout homme ça kaili monsieur nous en bois en bois avec tout temps nous pas fini Tony nous pas aller mais ou même c'est Tony qui ni bouti au go à terre so if we nous ni pour
Lisa, you both said about the time has come for us to have a discussion. For me all the facts are there. For me it's time to move beyond the discussion. That is me because there are certain things. Let's look at the whole aspect of drinking and driving. We've discussed it, we've spoken about it. We've heard about implementing breathalyzers. We've also heard about underage drinking. More and more you're seeing it happening. And as Cox and I were discussing off air, you know, just last year, being in the US with a friend of mine and going into the liquor store, I did not have my ID with me. And he had to purchase the alcohol. I mean, I don't think I look 16, far from that.
I was about to say Tony,
far from that. But we've been talking about those aspects of it. And definitely. We still go places and you see young persons consuming as much as they want. And we've seen the effects. I mean, you may not be drinking, but you're driving home casually and someone who would been consuming as much as he could just running into you. So I think even if this whole COVID, and we've looked at several aspects, you know, of the impact of COVID, and the talk, and I'm just hoping that after COVID, that certain things will be now on people. This is the way. Youth in agriculture, this is the plan we have to guide us. The whole drinking, this is the plan in terms of this is what it is.
You're so right, Tony. You're so right, because yesterday we had the fire chief on and other members of his team, and they were saying that with the lift of the suspension, they really now have to go back to ramping up how they're going to respond, because once that has happened, we know that there will be some people who will want to be excessive in their consumption, and so they're now preparing to having to respond to perhaps more accident scenes and that sort of thing. So it is very daily, but we do have sort of advice coming there from the Substance Abuse Advice Secretariat, Ms. Charmaine help me with her last name. I think I've forgotten the last name, but she is the coordinator of the council. So let's take in that clip from her.
The Substance Abuse Advisory Council Secretariat advises the public on the need to be mindful of substance use and misuse, especially at this time. It is important to note that the harmful consequences are not experienced only by the users, but also their family and by extension the community. For this reason, persons are encouraged to be mindful of use so that exposure to smoking, alcohol consumption, and other substance use can be minimized and, if possible, eradicated. The harmful consequences of substance use and misuse, including alcohol, pose harm both on one's physical and social health. It creates a means of depleting the existing health resources and also social issues like domestic violence and child maltreatment and abuse. Exposure to substance abuse further places vulnerable groups in a more susceptible position, thus compromising their immune system. While we understand that persons may feel bored or anxious, the department encourages persons to take this opportunity to bond with family and take greater measures to remain safe by following the hygiene guidelines. The use of 311 for additional support can be made, and services and other toll-free numbers being circulated on social media to be used. At this time, we remind you of one of our popular slogans: be bright, don't light, and be mindful that substance abuse, use, and misuse will further complicate our existing situation.
All right, and so that was the director of the Substance Abuse Advisory Council, Ms. Charmaine Hippolyte Emmanuel. I know that's, I was making a little joke. It seems that we're the ones a little tipsy in here with all of that talking. But, you know, fun aside, we had a really, really serious matter. And for me, it's really scary with the news of St. Lucia Distillers, where that place was broken into, and we had more than 100 liters of undiluted alcohol, being 95% pure, being stolen. And so the concern is, where is that alcohol? In whose possession? And what is the intent? What is the intent for this alcohol? Resale? Because in speaking with both Joanna and Fernanda Henry on the program, they indicated that there's nothing that we can put in this, and I say we as just the lay people, that's going to dilute,
quote unquote.
So don't think about putting your orange juice or your Coke in there or Sprite and mixing.
No amount.
No amount. You just would not know how to get that done. And so it is deadly, whichever way you look at it. It is deadly for you. And so let's take in the clip from the director of the St. Lucia Forensic Services, Fernanda Henry, on what this undiluted alcohol can do to your body.
Consuming that high percentage of alcohol can shut down our systems, and there's no other way about it. So you from your vision to eventually, you know, if it gets to your brain, it can shut down your respiratory centers, so it can have you to stop breathing, essentially. So so I want to implore those people who may, you know, we're being very realistic here. If anyone happens to consume it and they are experiencing blurred vision, they are experiencing dizziness, disorientation, that you should seek medical attention, because this is just the beginning of the symptoms that will progress eventually, that can progress to something more serious and eventually cause your system to shut down and lead to death.
And if you didn't want to take our word for it, you've heard it there from the expert herself, the director of St. Lucia's Forensic Lab, speaking to what can happen to the human body with the consumption of this undiluted alcohol. And the fear is that it has been stolen and perhaps it will make its way to communities, or, you know, just really people doing that sort of black market sale of that. And Tony, and one of our camera people pointed out there, but you know, you have alcohol that's at a higher percentage, but it's really not the same.
Yes, it's not the same.
C'est un bon nouvelle là, mais c'est moi juste voulais dire c'est que moi quoi moun supposé savent parmi développement nous t'en si maintenant c'est là vini pour vol là qui fait là distillerie à côté nous t'en 5 barils rhum et rhum ça nous a dit 95% pi. Et puis là nous t'en Henry et qu'a dit nous parmi l'autre bagaille. Ça c'est un bagay qui en ça cerveau affecté cerveau vision ou ça sent tout dit parce que cadeau ça pi tellement c'est pas un yon ça met en dedans pourquoi il kay mener pli kay molli ben mener pli dans manière pour ça boy question c'est côté tout monde ça nous ka demander ça nous ka dit côté tout monde ça avec avertissement aller pour dire moun pas supposé entamer boire monde ça. Et puis, moun volé pour qui ça? Et c'est là nous conseil là c'est pour qui ça? Est-ce que c'est homme nous pas ça faire ça? Est-ce c'est un blague qui vient sortir? Qui ça il vraiment quoi nous quand même à pile d'or là mais c'est son pièce d'information là ni pour faire puis ça ben si ou même un moun contact s'il plaît pas trouver qu'on involvé quand entamé boire homme ça qui trouver qu'on en même moun civilien citoyen place là parce que il kay affecté santo yon manière ben l'autre c'est ça qui en bouteille là yo a traité yo ramené dans manière ou peut ménager mais ça il tout pi moi ni te vle dire ça pour moun comprendre quand tu sérieux grave matière ça.
Absolutely. And I just want to say that, you know, growing up my grandmother always said never take drinks from people, so even people that you know. Never go purchase you go and it's already open, the bottle is open, and that sort of thing. So I would think, to me, that's where everyone should be taking their cue. Precaution. That if you are going to buy a drink, make sure you go to these licensed places. So we know at the supermarket, at the mini groceries, What's the other one?
Small grocery stores, wholesalers, and gas stations.
Right. Buy it there. You know what you're getting. Buy it there. It is safer.
What's the phrase, Cook? C'est pani situez.
Pani volé. Oui, son chay situez connaît nous kay. Mais yon a c'est bon bagay là moi que nous ni pour dire ici tout ça qui ga là. Il semble maman ni en chay pouvoir. Pour dire moi avant fête maman nous ten yo tié banda sou.
I didn't even think of that.
Moi kaka chile après fête maman moi hope nous pas en situation côté yo vie mais banda.
Right. But you know, I know we say that, but there's also the other side, and I think too that the cabinet of ministers and of course the command center really torn between having to balance the health of the nation, but also the health of the economy. And I think it is such a difficult line to have to tread.
It is.
Because, yes, you want to be able everyone to keep safe, to be healthy, not to be sick, but at the same time, you know, you have these manufacturers, they are employing people. And so they, to their financial lives, are hanging in the balance. And so, and then you don't want your economy to tank. You need to be able to keep that economy, the domestic economy, afloat as much as possible. So that, I think, is a very, very difficult decision to make, which is why I think it is important that every single person, those of you who are going out there, and yes, it is for you to be able to, you know, have a drink and relax, please follow the protocols. We know that there are no gatherings that must happen. We need to say that even the no gatherings, so which means that the bars and restaurants are not open for that particular reason. So if you're having a drink at home, don't sit and consume the entire bottle of wine and then you feel you can have another bottle and another bottle. So that is where knowing the limit comes in. So
Absolutely.
we have to understand all of those things, and don't drink with people. Like invite friends over. No, that is socializing.
Parce que yo teni condition moi content Lisa que ou mener point ça encore. La teni condition yo prend considération chaque bagay pour dire soit gain homme nan ou pas ça brailler là. Quand ou à gas station nan en bouteille homme ou gain panique de Tony gas en bouteille là en bois.
And don't go on the beach drinking,
thinking
that you are out in the open.
Curfew, you fait moun sav qui les homme ça ka vendre. C'était pour 6 heures au soir. Depuis 6 heures, on pas ka vendre encore. On ni pour changer ça. Moi quoi ça qui était bien important et quand chaque monde ko oublier, nous ka combattre envers mine toujours. Payant 24 nous teni 24 dans des temps yo mené 10 à présent ça depuis 7 heures pour 5 heures ou si poser la caillou nous savons aussi yo pas ka permettre moun pour ensemble tout monde vient ensemble distance sociale encore vers maintenant si vous venez pour un monde ou pas have ko monde qui ni exe yo dans ces bagay là moi quoi nous ka attendre ni constant et moi quoi c'est parce que monde pas attendre pièce là mort et ben monde pas attendre nous ni 20 ben 50 monde qui ni à présent monde qu'on nous ne pouvons prendre tout ça en considération avec nous ka plaider puis monde qui doit là pour changer masse là ces protocoles là en servi moun 6 pieds yon a l'autre distance sociale là ça en place toujours ou était caillou qui plus important quand les sans bien dit ça pas veut dire soit gain 4 bouteilles de vin on ne peut boire tous les 4 là même ou ça boire yon a dit yon après et ben mais c'est point temps ou c'est ça ou et pas inviter moun et nous ka wan chay ça ka fait mais c'est là vini pour moun massa boire pas quoi moi c'est pas moi qui Jesse pas moi qui Lisa à nous boire et massa côté Jesse aller ma have ko Tony c'est danger moi ka quoi ça c'est ligne nan yo ka chiller pour raison yo pas vle moun en ik boire ou savent des pour boire et go ha senti un petit manière oh tout pas tout au chaud pour à présent pas quand même calculer bien parce que vermine qui vermine qu'on a ni des hommes qui te homme dans vie moi ha boy vermine dans vie à présent ou a commencer à calculer comment ka quoi nous ka 17 lycéens pas dit nous ka parler les sujets nous ka dit monsieur pour qui ça moun ka faire ça bail mais nous ka dou changer pour suivre protocole laver la main là toujours masque là sous en public ou était hot yon à l'autre et ça qui plus important ou était caillou.
And alcohol does not kill the COVID-19 virus.
Yes.
Although it reduces if you don't consume as much, it reduces your susceptibility, you know, to or rather the opposite. It reduces your susceptibility to fight your COVID-19 or any respiratory illness.
Breaks down that immune system.
We also have to remind that even if the alcohol is free up, as we were saying, they free up the rum, beach limes, beach picnics, no river limes. We don't want to come across any videos on Sunday or Monday showing the police escorting hundreds of persons.
But more than that, Tony, but more than that, people dying as a result of drowning. We really don't want to have those news reports.
And giving the police added work to be doing on top of everything else that's going on.
Absolutely. We have to stick a pin in this. When we come back, we will be talking about the last week of cautions and arrests that have been made for curfew violations. And we will be opening the line. So if you want to call and make your contribution, you can do that. But we're due for a break. Do stay tuned. When we come back, we hear from the Acting Commissioner of Police. Stay tuned.
With all that's happening around us, simple adjustments are necessary to keep us all safe. When calling 911, we may need a little more information to deploy the right personnel and protocols. You may be asked about your travel history, signs and symptoms, contact and movement history, and whether others in your household are exhibiting similar symptoms. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
Ready to harm us. Panic is not the answer.
sanitizer. Better yet, use soap and water.
We must protect each other if we are to beat this corona. Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are no, no.
Advice, give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Thank you so very much for staying tuned. If you're just joining us, you're joining at the tail end of our broadcast this morning. This is the St. Lucia COVID-19 Response Report. We are live on NTN from the GIS studios at the Information Command Center, bringing you information of the week that was, everything that has transpired in the last week, from confirming another case of COVID-19 to repatriating our cruise line workers, the lifting of the alcohol suspension, and at this point we come to the information from the Royal St. Lucia Police Force. This week we saw video footage of a social gathering in Union, where there were reports of off-duty police officers joining in and some choice words being shared by one civilian to law enforcement, as well as if we go further back in the week, I believe it was Sunday that video footage was being shared about the place, the River Lime in Ancillary, of the a group of young people being escorted to the police station for their activities by the river. We heard from the Acting Commissioner of Police. He spoke, he gave a response to the viral video on social media of the police encounter with the civilian at the social gathering in Union. Take a listen.
This incident is of concern to us, especially since it would appear that members of the police force were in attendance. The Royal St. Lucia Police Force condemns this sort of behavior and have launched investigations into this incident. I must commend at this point Sergeant Xavier and his response team in the calm manner in which they dealt with the situation. We are actively pursuing these individuals and are calling upon them to report themselves to the CID today, or else the police will find them. I will not allow the hard work of the police in maintaining law and order, especially during this COVID period, to be diminished by a few who appears to be on the other side of the law.
And then there was also the concern by persons on social media and so on, why weren't the individuals who were caught in violation not arrested on the spot? The commissioner explained that there was a call for backup. It did not come as they wanted it to, and it was the safer thing. The officers then and there using their discretion under the environment in making that arrest. But we did see a follow-up to that, and arrests were made in response to the Union incident, and hopefully we will get an update from the commissioner at his usual weekly appearance next week. We have another clip of the commissioner explaining the cautioning of individuals. Again, we did not hear of the immediate arrest and charging of the individuals from the ancillary River Lime, as well as the 16 individuals who were cautioned for breaking curfew, for violating curfew at CID. And he explains what cautioning meant when they said it, and explains how the arrest process is happening so far with the vast number of persons being arrested at one point in time.
In general, cautioning is not lessening the measures. There would be instances, and every situation would differ. Probably an officer on patrol may meet a group of individuals, 10 or so, and then they would be directed to return home, go home, or if they may have been late from coming coming from work. So you would use that opportunity to warn these individuals, let them know that they should not do this, they should be in, and so on. And that too goes into our community, in as much as that the community policing aspect that we do. However, when one is cautioned, like the ancillary incident, those persons, it's not that that is it for them.
Okay.
On the day in question, because of the numbers, we could not have detained everybody because of social distancing. Again, if you were to put everybody 6 feet apart at a cell, we would not have cells to have those individuals detained. So what they would do is to caution them, and that caution is informing them that they will be prosecuted for the offense that they have committed. So instead of charging them at the time and then to bring them up for bail, they would be processed, the case is lodged in the court, and a summons would be issued for them to return to court on a particular day.
That was Milton Daisy, the Acting Commissioner of Police, explaining what it was meant when the report came out that these large numbers of individuals from the ancillary Riverline and the 16 individuals at CID, what it meant that they were being cautioned. Just to go back to the police officers being part of the social gathering in Union, the commissioner also stated that they would be held accountable equally as like any other civilian under the curfew order, the punitive measures put therein. So that's the word there from the law enforcement on the social gatherings. And you know, we do hope that going into this new week, we have had the lift of the suspension of alcohol, suspension of liquor licenses in St. Lucia. We do hope that you proceed with, you know, with care when you're at home. We hope you don't bring persons into your homes. We hope you don't gather and have little social activities, soirees, beach parties, river limes, what have you, because the state of emergency is still on. You know, I think every couple of weeks, you know, we have to remind persons that the state of emergency still stands. It has been extended throughout the month of May, and we want persons to ensure that they stay on the right side of the law during this time. Take all the precautions you must to protect you and your family, and to avoid, you know, getting locked up or getting detained by police.
We do have the Minister for Health and Wellness, Senator Honorable Mary Isaac, who made that very appeal. Just if we can go to Minister Honorable Mary Isaac with that appeal for persons to adhere to the protocols.
It is true that we are relaxing a lot of different business activity, essential business activity, and as the days go by, we will continue to gradually open up some of these activities. But at the same time, we must continue to practice the social distancing protocol, because this is the only way we will be able to continue opening up our country until we can freely do so. But distancing and wearing our mask, these are two activities I believe that is going to be with us for a very long time. The police cannot be everywhere at the same time. We have a limited capacity when it comes to our police force. We have to be each other's keeper at this point in time, because you have to protect me from you, and I have to protect myself from you as well. I also have to protect you from myself, because we come into contact with different people all day long, and we do not know who is carrying the virus.
Is there a penalty, Madam Minister?
There is a penalty for disregarding the curfew or breaking the curfew. It is $1,000 or 6 months imprisonment, or both, or a lesser fine. That depends, right? But we do not want to have to impose penalties.
And that's Minister Honorable Mary Isaac there. And for the minister, she made excellent point there. We really don't need anyone to have to tell us that we must adhere to the protocols, one, and to just recognize that the state of emergency remains in effect. I think that so often in our society, and I say this all the time, we have fast become a people where personal responsibility seems to have gone out of the window, and we simply just blame everyone else for every possible predicament that we may find ourselves in. So if we are the first line of defense for ourselves. So if we do what we need to do, I know that I must simply observe all the protocols, wash my hands, wear my mask, especially when I'm out, and so forth. I'll be okay. At least I'm doing the first line of defense. So the minister, they're absolutely correct. Personal responsibility, we need to get that in. Tony?
Well, we just want to let you guys know that the lines are open for you to make your contribution. The number you can call is 468-2162. You can call 468-2162 to make your contribution on the week that was from the confirmation of the COVID-19 case this week, the persons coming in from the cruise ships being repatriated, all of the developments from this week.
And just a reminder as well that we have our students at home learning from home. The third term continues at home. It's also Reading Month here in St. Lucia, and one of the guests we had this week was Angel Caglin, who's the curriculum officer, English language. And one of the interesting points she made during that discussion was that getting persons to understand the difference between learning from home and homeschooling. You know, that they're not expecting parents to overnight become teachers. And she also spoke about the whole purpose for reading. So let's take a listen to what Ms. Caglin had to say this week during our interview.
Before we do that, we have a
we have a call?
Yes.
Hi, good day. Can you tell us where you're calling from?
Hello? Yeah, good day.
Hello, good day. Can you tell us where you're calling from this morning?
Yeah, calling from Balka.
Balka. What's your contribution, sir?
Yeah, well, so long we work people food and we I disabled, I was stroke and they're not even paying for the labor.
Okay, I think I can say something about Nemo, and he has had a stroke.
Okay. So I don't have no food. So what's the problem now?
He has no food.
Okay, so it would be best if our producer can take his telephone number. We'll take your telephone number. And we'll be able to get back with you and organize for some assistance for you. Okay, so I think, so I think they've
taken the call.
Okay.
Tony?
Okay, yeah, so I was saying the curriculum officer for English language, Ms. Angel Caglin, we spoke about differentiating learning from home and homeschooling, and also Reading Month, some of the activities that the ministry have planned and the reasons for reading.
Technically, homeschooling, you need to know the curriculum. You need to know what should be taught to a child. You need to know what content, what skills, what attitudes they need to develop. And as far as I know, in most places, you need permission from the education authority to homeschool your children. But learning from home is different. We're not expecting parents to be teachers. We're not expecting parents to be aware of the curriculum for English, for math, for science, etc. But education does not happen only in a school building. Learning happens everywhere. And that is why we have lifelong learners. So learning from home is different. Learning from home is, let's see how we can use a combination of teacher support in whatever way it may come. It may be online for some. It may be through educational packages that come to the home. That supports the formal learning curriculum. But we also have a lot of learning that can happen in the home. When you're cooking, when you're designing, maybe redesigning a recipe, when you're doing gardening, when you're sorting clothes. Any of these activities teach students, teach children very valuable skills, but it also allows them to link it to the formal curriculum and the content that they may be learning there.
And that was Ms. Angel Caglin, Curriculum Officer for English Language, Ministry of Education, differentiating their learning from home as opposed to homeschooling. As I mentioned as well, it's Reading Month, and Ms. Caglin also spoke about the initiative when it comes to Reading Month here in St. Lucia.
One of the things we want people to see is that reading, in the school environment, reading has a goal. And that goal is, we like to say, comprehension. And usually any student will tell you when they read, they're supposed to either answer some questions or write something or react in some way. But why not just read to satisfy yourself, right? Why not read to satisfy your own curiosity? Why not read to distress? Why not read just to enjoy? But we also want to put reading in context. So like I said before, as educators, we may just repeat, the end goal of reading is comprehension. But as we were talking before, the end goal of reading is not necessarily comprehension. It's to be able to use this information in some way, to build out new meaning or new understanding for ourselves, or even to build new content. Now with that in mind, imagine this happening at home. So it's not about something that you do because the teacher requires you to do it, or because you have to hand in something. You're doing this because it's just part of life and part of learning. So the calendar of activities that we came up with reflects the varying circumstances that we have among teachers, among students, among families.
The joys of reading, Lisa. Remember your days at school? What you enjoyed reading the most?
I was a student of literature.
Okay.
But I have to.
Shakespeare, Macbeth.
Yes, all of that. Merchant of Venice, all of that. But I love what she said about reading. It has to be enjoyable, and when you because it will require children being able to sit still for a moment and picking up the book. So you need to start children off with something that appeals to them. There's nothing wrong with that. You don't have to, when you tell a child reading, and some parents believe that you must give them the textbook for them to sit and read.
The obligatory aspects to it,
Make it fun for the children, and in that way. So I used to read a lot of the Nancy Drew, the Hardy Boys, my spare time. Nothing wrong with as you go in a little romance novel, as a teenage girl, you love all that fantasy, age appropriate, of course. But that begins to just stimulates the mind. And when you have to stimulate that mind, for me, when I read, I'm really transported into sort of movie land. I literally see what I am reading.
You place yourself in the story.
I am there in the story. I am that character. I'm running through the woods doing all those sorts of things. And it's fun. It's great. Importantly, that's how you develop critical thinking. So even though your child may not be reading that textbook, allow them to read what appeals to them in the very beginning. And so once they now get into that rhythm of reading, then they will also read not just for enjoyment and for fun, but they'll also read for research and that sort of thing. So just keep the kids interested, keep them interested in the reading, and it's going to pan out well. I know that now the hip thing is to drop letters in words because we're all on social media, and there's the particular language and all of that sort of thing. And the standard English is fast becoming a no-no in the society. But I'm telling you, no, the world still demands that. And you will be a better person for reading and for knowing that standard English.
Right. Even if the technology is there, the technology is there to be used. And we also spoke this week of Siobhan James Alexander, the CEO of Digicel. She spoke about the support that has been given to the Ministry of Education of the whole e-learning, working from home with the students and what have you. Let's take a listen to what she had to say.
When COVID-19 happened, we recognized our own possibilities, and we recognized our role in helping. We know that there are gaps in terms of connectivity, and that's probably the first thing that we tried to address when we gave the 500 MiFis. Scoping how many people were missing and what those gaps are was probably our biggest challenge, and remains our biggest challenge. And I think Caitlin kind of pointed that out today, that there's still that gap. And it's not just connectivity, it's also devices. But apart from that, we recognized also that there was e-learning, and that the new normal wasn't a brick and mortar kind of school. It would have needed a platform. And we know there are lots of platforms, Google, etc., out there. But we dealt with Microsoft Teams, and it's part of our vendor partnership, and we offered that first to the ministry. And so today I'm proud to say that we've now trained teachers in using the platform. And why is that important? Because if you ask the students, they use a lot of Microsoft Teams. They use a lot of Word and Excel. And the collaboration within that platform is a lot more seamless than the others. So I think it presented an opportunity for us to help. It's probably a leapfrog versus, our traditional sides of how we did education versus now.
That was the CEO of Digital, Siobhan Alexander James, talking about the support. And one of the things that was key, and we've heard the discussions in terms of providing students with devices, it's not simply giving a child a device. The capability, the capacity, having the correct platforms. And she also mentioned the training of teachers, which was also key to giving that support to the government of St. Lucia moving forward.
Wonderful.
Et puis, oui, si vous continuez à écouter nous, nous allons dire bonjour, merci tellement pour vous qui écoutez, nous. Nous ici à Headquarters 20 COVID-19, ici à Studio GIS. Quand la coutume les samedis, nous avons réfléchi à tout ça qui passe en semaine maintenant. Et nous avons adressé un pile sujet. Vous savez, parmi eux, car nous avons en semaine, c'est mon qui a retourné l'autre pays qui est à sous ces bâtiments. Nous parlons sous rapport qui Premier ministre nous trouve qu'il y a prêté les deux comités, il y a un OICS et puis il y a un CARICOM. Nous aussi t'en l'année pour faire puis WOM qui nous t'en honorable Bradley Felix l'année pour faire puis ça qui WOM n'a eu pas permission pour se placer ça et qu'à présent nous parlons sur éducation. Nouvelle ligne Limoa 468 Dayon 6D nous n'avons sur ligne fait contribution. Bonjour. Hello?
Hello? No.
Hello?
Hello, could you go ahead with your contribution?
Oh, hello. This is Dawn from New York. How are you?
Doing great. Thank you. Good morning, New York.
Good morning. I just want you guys to know that you're doing a wonderful job. I watch you guys every day. As you know, New York is still in a mess, but we're getting there. And I just want to remind everybody in St. Lucia to please... Hello, can you hear me?
Yes, go ahead. You go ahead.
Oh, there you are. Just please be patient with each other. Please be vigilant and just learn from what's going on in other countries. And just thank you for doing what you do for everybody in your country. And that's it.
Do
And be
you,
your
before
brother's
you leave,
first-
are you St. Lucian?
No, I'm just an American who visits your country quite often, and I love your
really?
people.
Okay. Wonderful. Thank you so very much for your contribution.
But I was interested
Yes.
though, Dawn, I'm just interested in just how you feel about what's happening with COVID in New York. What is your experience like? Are you confined to home?
Well, right now, my job and my daughter's job are both considered essential. So we do go to work, but we do come right home and we stay in the home. And we've been in the home, other than going back and forth to work, since March, I think it was March 20th. So that has been a little difficult for her and myself, but we know that it's the right thing to do because we don't want to, God forbid, bring something to somebody else's home. We both do not have any symptoms. We do not have any COVID illness. We knew a few people that did. They did not adhere to things that they were supposed to adhere to. Not that that really matters. Well, it does. You just have to be very vigilant. And the social gathering, it will come at the right time. Just right now, everybody needs to listen, remain at home. It's been, I don't know, I guess 2 months now. We're all losing track of time. People are getting very anxious. And good things are not happening, even though we do see light at the end of the tunnel. I think people are just getting scared and just doing foolish things. So I think it's better to remain at home unless you're an essential worker. I think it's better not to, try not to at least, consume too much alcohol or drugs or anything like that that can impair your judgment because it's not going to lead to anything good.
Well,
So
Dawn,
again, I
thank you
listen
very
to you guys every day. The Prime Minister is doing what he can do, the President of the United States is doing. Everybody has something to say about everybody in government. If we could all just work together, not criticize each other, get past this, and then the differences can be resolved at another time.
Absolutely. Thank you very much, Dawn, for that. We hope that you continue to keep safe, and we hope that things come back to a point where you can visit us again.
Oh, I plan to. I have a few trips on the horizon planned.
Wonderful, yes.
We'll do have an
And
enjoyable
Carlton,
day.
just so you know, you make me laugh every day. I have no idea what you're saying. I always ask my friends, and they never get back to me fast enough. But I don't know what Caillou means. That's the only word I don't really, but you say it a lot.
What was it?
Thank you, Don. Happy
I think
Mother's
I should say
Day.
Sakafet, I think. The one word that
Thank
she
you.
knows.
Have a great day, ladies. Bye.
Thank you so much there,
She was just
Dawn.
commending you. She says she likes to listen. She has no idea what you're saying.
Cousin, it's that face of yours and the smile and everything.
Oh, yes,
you know, but
definitely.
people like
Always
Dawn, you know,
laughing.
this is something that we sometimes flies over our head. But we do have foreign nationals, the people from the international community. They have an affinity to St. Lucia.
Yeah, they're following.
Because I think I remember one hearing that someone had donated to St. Lucia, and people were saying, what is a person getting on the back end of it? And that. But no, there are people out there who genuinely love St. Lucia. They have a concern for the people of St. Lucia because this is where they vacation all the time.
Exactly.
They develop friendships and that sort of thing.
If you think of hotels like Sandals, they have their special arrangements for returning guests. So it's all sort of like a culture that not everybody's aware of, but you know, we have been a tourism destination for a very long time, and generations of families are used to coming here all the time. It's their second home.
Yeah, I remember meeting a German, just about in 2018, I met a German national.
We have somebody on the line.
Okay.
Sorry.
Don?
Hello?
Okay, I think we lost her. I was saying that I met a German national, and he came on vacation for just about, he said, for 6 weeks, and the year was coming to a close.
on him being
From
here.
6 weeks, the year was coming to a close because he just fell in love with St. Lucia, and he was planning on returning to begin to close up shop at home in Germany and to come back to St. Lucia to make St. Lucia his retirement home.
Now, if you love St. Lucia, we just want to, first of all, thank all of the individuals who have so far donated toward the COVID-19 response here in St. Lucia. This week we had the DSH group donating generously. We got a donation of testing kits from the government and people of the Cayman Islands, as well as Event Star Construction. They donated face shields, as well as Courts Unicoma making their donation. But if you want to make a contribution as well, however small, you can make that donation via our GoFundMe page, and the objective is to make that donation. The objective is to reach $100,000 US. We're now at $72,350. So if you want to make a contribution via that platform, you can do so. To date, from the telethon, Cooks, we've collected 1.8 million of the over $2.5 million that has been collected so far. And if you want to make a contribution to that effort, you can make a deposit in the account number at Bank of St. Lucia 1045111121. Also, the name on the account is the National Community Foundation, so you can make sure that's where you're sending the money to. And if you're abroad, you're in the diaspora, you're a foreigner, you want to make a contribution, the SWIFT code that you can use is BOSLLCLC.
So Jesse, could I make a contribution at this time? Well, folks, as we all know, well, let me go into camera. It's live TV, right?
It's live.
Tomorrow is Mother's Day. So we have on set with us our lovely first-time mother.
Aww.
And on behalf of all of us here at the Information Command Center, we have a presentation. I know it's a day away.
Thank you very
This is for
much,
you.
everybody.
Congratulations.
Thank you. Social distancing, I can't hug and kiss
Yeah, no
everybody.
hugs, no
okay.
kisses. And we also have with us, let me just go back across here. Like I said, it's live TV today, guys. I mean,
Wow,
More
thank
gifts,
you so much.
more gifts.
yes, we have more gifts.
Mother's Day celebration.
Sorry, Cokes, there's no gift for you. It's mothers. It's all about the mothers today.
It's a woman thing.
So we also have two very lovely ladies with us who, I mean, we have Natalie. Come forward, Natalie. Natalie is the one responsible for doing all our sanitizing, making sure that, you know, everything is proper around
She
here.
does heavy sanitation.
Yes, yes, and she always comes to me, you know, the set is ready for you to go on. So this is for you, Natalie. Happy Mother's Day.
Happy Mother's Day
to you. And we also have our trusted security here, always making sure that we're safe whilst we're here, that we don't have any persons coming in here and violating our presence here.
You know, it's what's off camera that's best.
Happy Mother's Day to you. And hold on,
Happy
we have another
Mother's
presentation
Day
to you as well. So, on behalf of Digicel, I'd like to present you your MiFi device. We know that you have 2 kids at home who have to be doing their learning at home as well, so this will assist tremendously. So on behalf of Digicel, this is your very own MiFi device.
Thank you.
Okay, it's that kind of Saturday for.
This is a tearjerker. It's a tearjerker.
Yes.
Oh my
Yes.
gosh.
And we have tremendous
There's
love for
nothing
all
more
of
in the
these
bag
ladies.
here, so there's no, we have no drinks, anything else in the bag.
Okay,
On that note, I will make my-
the other lady in the room, apart from myself, so it's Naomi and Lisa here in the
Hopefully
room.
next year you guys will be getting some gifts.
But
Yeah.
What's up with that?
You have 9 months plus. Let's put it that way.
But I certainly want to say, nonetheless, a happy Mother's Day. I certainly want to say happy Mother's Day to Lisa Joseph.
You want to say happy Mother's Day?
Happy
to
Mother's
me?
Day, Lisa Joseph,
Ah.
because you know what? Because Lisa is, you know, the mother of all the upcoming journalists and media
Definitely. I would
practitioners
agree.
in St. Lucia.
I am not old people.
I don't want to put you in a matronly position, but you have been that mom to us. So happy Mother's Day, Lisa.
Thank you very much,
Hopefully
Jessie.
next year we'll be presenting to Miss Lee, Nicole McDonald, and Lisa as well next year, hopefully. Yeah. Yeah. So continue the discussion, guys. Let me just make my exit, or probably I'll join you guys to wrap up in a bit.
Thank you very much.
What we then?
Thank you very much, Tony.
Yes,
Tony.
Yes, I call him that, Tony Tone. So thank him.
Yeah,
thank
what
him
we're
so
going to do is go
much.
to a break, and so I could see what's in this bag. And when we come back, our final segment. Stay tuned.
And in the latest news, the coronavirus, or COVID-19, continues to be a health emergency across the world. Caribbean people are concerned.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. And don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Red Cross volunteers from across the Caribbean, working hard to fight discrimination. So if a person should feel ill, then they will contact the authorities without hesitation.
The most vulnerable are the elderly, but the truth is it can infect anybody. So what we need is solidarity. Everyone helping everyone like a family. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening.
People around the world facing this pandemic. Coronavirus have the whole world a panic. Now is not the time to be fearful, but to be careful, supportive and empathetic.
This is the state of the society. Some people full of fear and anxiety. Yo, a lot of fake news in the community. But what we need now is more love and unity. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
And welcome back. And that PSA we just saw there was compliments Red Cross and SEDIMA. And we would not be forgiven if we didn't mention World Red Cross Day, which was celebrated this week. And we also have to point out that our trusted technician, Roger Vario, you cannot talk about Red Cross without mentioning Roger Vario, who's also doing a wonderful job here with us behind the scenes. So there's no gift for you, Roger, for Red Cross Day, but we just want to say happy anniversary, happy Red Cross Day to all the volunteers in St. Lucian from around the world.
And Red Crescent.
Red Crescent as well, who also been assisting in some of the endeavors with the vulnerable persons, assisting NEMO as well with some of the care packages that were given. So that was very important. Yes. And we just